we hope to do another study looking specifically at children hospitalized with bronchiolitis and whether HEPA filters can decrease symptoms after bronchiolitis hospitalization. Ventilation is very important in a colleague of mine in Canada has shown that heat recovery ventilators were associated with a decrease in a placebo-controlled trial were associated with decreased respiratory symptoms, specifically upper respiratory symptoms in children. There's a lot of information around dust and dust mites and use of impermeable pillow and mattress covers, washing, removing carpet, cleaning, pets, and the association of mold and people who are allergic to mold, and then irritants. And there's a number of efforts to use HEPA filters and increase ventilation and green cleaning products. So in 2009, colleagues here in Alaska at DHE, at Division of Environmental Health and Engineering, contacted us at Centers for Disease Control. And out of that collaboration with that then involved YKHC, Yukon Custom Health Corporation, and Bristol Bay, we did a study looking before and after at children with chronic lung disease to see if home improvements could reduce pollutants and improve health in children with lung disease. We initially hoped to do a placebo-controlled trial, but the tribal organization did not approve that, and so we went with a before and after design. And we had environmental engineers that assessed the home for indoor air quality, and then with the local tribal housing, did small renovations to the home, around, as I remember, about $5,000 in general. Those included new wood stoves, EPA certified wood stoves when needed, vents, range hoods, mold remediation, bathroom fans, etc. But they also did healthy homes education and asthma education, and we checked indoor air quality. We looked at lung symptoms before and after, and then also at medical visits. And what did we find? Well, I think one thing that really, I hit the wrong button. One thing that really characterized these homes was a significant difference from the U.S. general homes from the American Community Survey. In these homes had an average of 7.3 occupants compared to the U.S. average of 2.6. The median square feet was 920. 73% were crowded, as defined by greater than one person per room. 16% used a wood stove. 49% had a smoker, although most smokers smoked outside the home, and we verified that, and 60% of these homes had no running water. Oops, I'm gonna have to, sorry, I have a problem with my screen. I'll have to get back on. I made one error, excuse me, this will just take a second. I lost my screen momentarily. So I'm gonna go down. Sorry about this. Okay, here we go. We also were able to associate the high levels of pollutants that we found, namely volatile organic compounds and small particulates, PM 2.5, and their association with cough, wheeze, and lung infections in children. So they were associated with a higher rate of reported cough, wheeze, and lung infection. After the home improvement, we were able to show a decrease in parent-reported symptoms, specifically colds and runny nose, cough between cold and wet cough, and wheezing with cold, and a need for an inhaler. We also showed a significant difference in parent-reported missed school, specifically for respiratory infections. And all these were about a 50% or more decrease. And we showed a decrease in visits for lung infections in the high-risk children. After that study, we felt that it was important. We were looking for a way to expand this into more homes through a more cost-effective kind of modality. So we came up with doing consults in high-risk children that were hospitalized with respiratory infection. So in around 2016, we collaborated with a number of tribal health organizations, and now this was done with Abby Nelson, AJ Sulkowski, and a number of colleagues from Community Environment and Health at ANTHC. And we wanted to test the feasibility of hospital-based environmental consults. So what we did was we had environmental health consults come in, they did informed consent, and then they provide with caregivers of children who were hospitalized at the Alaska Native Medical Center with respiratory illness. And they provided education on home environment, best burn practices, cleaning, water and mold mitigation. And they mailed to the home an indoor air toolkit that had standard cue cards and a CO monitor, a moisture tester. I'll go over what was in these. And then they did a housing referral when one was needed to fix wood stoves, to improve ventilation, etc. And this is the Air Matters toolkit that we use. This was developed by the Tribal Healthy Homes Network. And we ended up actually developing our own and shipping them out, or compiling our own based on the Healthy Homes Network, because it was a little bit more cost effective and we could do it faster. And you can see all the items that were included in the kits. The standard education included the ventilation system, wood stove, best burning, cigarette and smoke exposure, allergens, including pillow and mattress case encasements, cleaning recommendations, chemical storage, alarms for carbon monoxide and others, and specific guidance about washing hands. And what was interesting was we looked before and after on behaviors and what the families said they were doing. And we saw decreases like in humidifier use, which was over humidification was a problem. And that significantly decreased after specific education on that. Similarly, dusting, there was specific information provided about dusting, about washing bedding, about ventilation, about wood burning, and using a stove thermometer for best burn practices, and those were changed. We did see a change, an improvement in respiratory symptoms over time, although this was not a placebo-controlled trial. And then the daily medical costs of participants are, we calculated those based on reviews over a 2-year period for these children. And we found that the overall cost, the median overall cost for 2 years was $70,000 per child. These were children that were hospitalized and had multiple medical visits and often 2, 3, 4 or more hospitalizations. And we found that those total medical costs, which was about $174 a day, were significantly lower in households that had running water, piped water, in households that did not have furry pets, and in older children that had mechanical ventilation during the index hospitalization, they had also much higher costs. So just, we published this information in Journal of Community Health. And I think some of the take-home messages are environmental factors have a profound impact on medical costs. Those costs are significant in high-risk children. And doing environmental health consults are feasible. The parents actually appreciated the information. They did act on the advice. They did use the toolkit. And one of our next steps is, how do we make this sustainable? I mentioned that we are doing, we're hoping to engage in a multi-center study, placebo-controlled study looking at HEPA filters. Our colleagues are working with Medicaid to look into getting a waiver for having environmental health consults. But it's clear that this is an area that needs more effort because many of these hospitalizations and visits are preventable if we can impact right here at the beginning those early pneumonia hospitalizations that end up costing the child and society a huge amount of money. So that's all I have. And I think I'm going to hand it back to Dana to introduce Sarah. And I'll stop my sharing, okay?
Thank you, Roz. That was very interesting, and thanks for the update on what ANTHC is doing in terms of health research. I think we're going to move right on to our next speaker and have questions at the end. So Oxinian Diamond works for ANTHC's Community Environment and Health Group. And she started as the Healthy Homes program manager in March of this year. So she's had a busy onboarding for this new job. And she's going to be speaking to us a bit today about updating us on materials to promote healthy homes during the COVID era. So I will turn it over to you, Oxinia.
Okay, thanks, Hazel. To add on to the work that we've done with the Healthy Homes consults, hospital consults, we've also really encouraged a lot of outreach, especially in times of COVID. And so on our Community Environment and Health COVID research page, which is housed on our Alaska Tribal Conference on Environmental Management website, we have resources available that came from across the state, not only the ones that we developed here at ANTHC, but some of our tribal partners, YKHC, Manilik, or some other resources that we do have available on the site. But all of our resources include touch on a healthy home and a community with home resources, community resources, some clinical resources, and local business resources in a community. They're all available for anybody to use. We've also, with boosting up our outreach, we've created a distribution list that we do send out all of our resources to our tribal communities across the state. And if you go to the next slide, please. A lot of our focus in the Healthy Homes program with building up our outreach material was focused on the home. One of them, to keep your home clean, to keep your home safe, contaminant free, ventilated, and dry. And so with that in mind, all of our outreach material touches on those. On the next slide is just a snapshot of some of the resources that we have available on the website. Some of our first outreach material was managing the anxiety and stress during COVID, as we were all sent home to hunker down a bit, and how to kind of balance and maintain a healthy lifestyle right inside the home. And then we talked a lot about cleaning and disinfecting, and then ventilation, and how to stop the spread of the virus or any illnesses in the home. Next slide, please. As part of our outreach, we also developed, along with the CARES Act funding that came out, that was available across the nation. We took those guidances and all the information from the CARES Act and created our own guidances that targeted municipalities in a rural community, and the tribal organizations in a rural community. And in the guidances, it gave some background about the CARES Act and a lot of the guidances and regulations. And then further along in the documents, we also provide information and ideas on what some of the CARES Act funding could be used for. This was a big collaborative effort within our organization. We worked with several departments in our legal department to be able to touch on every piece of the CARES Act guidance so that rural communities were knew exactly what they could spend their CARES Act funding on as they were planning to prevent and mitigate the virus if it entered their rural community. And on the next slide, we also provided in community environment health, we provided a statewide COVID best practices webinar where we touched a lot on what the virus was, some best practices in the home and best practices in the community, and where to find the best information. The link on the bottom of the slide is to that recorded webinar. And I know that in our department, we've been planning to update that webinar and do another statewide webinar available with any new CDC guidance that has come out. This one we did back in late April, early May. And so we're talking about how we needed to provide another statewide webinar for our rural communities. And next slide, please. Also on our ANTHC site, the main ANTHC website, we do have a COVID resource page that talks a lot about administrative resources, any information that's been shared from the Alaska Department of Health and Social Services, some clinical guidelines for local health care, telehealth resources, and then healthy tips and recommendations for patients, whether they're going to their rural clinic or coming into the regional hospital or coming here to Anchorage to our hospital for care. And I think that was actually my last slide. All of this kind of really came about because we wanted our communities and homes to be best prepared for when the virus reached their home more on a personal level. And that's just some of the stuff that we're doing that I just wanted to touch base a little bit and share. All of them, like I was saying, is on our AtCam website. So www.atcamak.com. And coming up on December 14th through 18th, we'll also hold our AtCam conference. So it's the Alaska Tribal Conference on Environmental Management. And typically we're going virtual this year, but typically we have about 500 participants from all the way from local tribal organizations, local communities, to regional organizations and statewide and federal partners that come together to talk about all of the environmental issues that face the communities. And we are still planning on holding the conference, even though it will be virtual this year. And that was really all that I had to share. Thank you.
Thanks, Aksiniya, for that great overview of what you have been busy doing to protect people and work on the home environment in rural Alaska. If you wouldn't mind, if you could put in the chat box maybe the information on that AtCam conference and then the web link to your materials, if that's convenient to do during our next speaker. So another one of the performance elements for our health and well-being team is to, in collaboration with ANTHC and the state of Alaska, to characterize the health consequences associated with the decreased access to in-home water and sanitation services. So our next speaker is going to be talking a little bit about that. Dr. Michael Bruce is the director of the CDC Arctic Investigations Program in Anchorage, and he has been an epidemiologist working here in Alaska for over 20 years, and he's going to be presenting some of the research that CDC has done documenting the impact of lack of running water within the home and that impact on infectious diseases. So I will turn it over to you.
Okay, let's see. Are my slides coming up for share screen now? Did that pop up? Do you guys
Not
see them?
yet. If you go to the green share screen button at the bottom of Zoom.
Okay, that's what I clicked on. Huh.
And then you'll have to select which screen you'd like to share or which window. Yep.
Right, I did.
That is
okay.
working now.
Okay, great. All right. Well, hi everyone. Thank you, Dana. As Dana said, I'm going to be talking to you a little bit about some of the water wash diseases in rural Alaska. And I wanted to thank Dana for putting together many of these slides and helping me out during this busy time. Let's see, it's not advancing. Let's see. There we go. Just the CDC disclaimer. This presentation represents conclusions from myself and not necessarily CDC. And I'm trying to move there we go. Okay. Just to start off with a little bit of background, this is a slide looking from 1940 through 2010 on the x-axis. On the y-axis, it's the percent of U.S. homes that have complete plumbing. And you can see that yellow line there represents the United States. And the U.S. sort of post-World War II, our plumbing improved across the nation with folks receiving running water in the 50s, 60s, 70s, dramatic improvements all the way up until, almost all homes in the United States now have running water in them. The red line below it is Alaska, and Alaska has always been behind the United States, the other states in the U.S., and the big yellow dots represent rural Alaska, where somewhere around 20 to 30% of rural Alaska still does not have running water currently. So I am going to talk a little bit about some of the studies that have been done in the past, and then hone in on a couple recent studies and their findings, and just kind of very briefly review what we've learned. So I have these two main boxes that I think you see here, and these represent communities that have homes without running water compared to homes with running water. And we did some studies over a decade ago in which we looked at communities across Alaska, and we looked at those without running water, those with running water, and we looked at a variety of different infectious disease outcomes of people living in those communities. And one of the things that we found was that people who lived in communities and homes without running water, that there was an increased risk of hospitalization due to a variety of things, to lower respiratory tract infection, RSV infection, pneumonia, influenza, and a variety of other infections, including skin infections and invasive pneumococcal disease. So we found, and it was, I guess it sort of sounds intuitive, no big surprise that homes without running water had higher rates of these infectious diseases than homes with running water. And we needed to do that because there was a question about, whether this was a major problem out in our rural areas, and there still were people wondering about this, even though it seems very intuitive. So we did some of these studies to show it. We also did later studies that looked at outpatient visits, and we found again that homes without running water had a higher, an increased risk of outpatient visits due to skin infections and respiratory tract infections compared to homes that have running water. And I'll show you the list of all the different studies. These are studies done by Tom Hennessy, Tim Thomas, myself, Dana, who's on the call. Roz was involved in some of them, Roz Singleton, and a variety of other folks, but there's a list of all the different papers at the end if you want to look at them or get more information. So we also did studies looking at homes without running water versus homes with running water, and found that there was an increased risk of Giardia exposure in homes that didn't have running water in rural Alaska. We also found that there were increased rates of dental caries in children that lived in villages without running water and in those without fluoridated water. And then we also found that there was a higher use of sugar-sweetened beverages in homes without running water. And I'll talk to you a little bit more about that in detail in one of the studies that's come out fairly recently. We also did what we called the 4-village study. It was a collaboration between the YKHC, the Alaskan Native Tribal Health Consortium, and CDC and our group. And we looked at 4 rural villages in Alaska in the 3 years prior to their receiving running water and the 3 years after receiving running water. And again, we found that in the 3 years after receiving running water, the rates of respiratory infections declined, rates of gastrointestinal infections declined, and rates of skin and soft tissue infections declined. So we showed that having piped water in villages really does make a major difference in infectious disease outcomes. We also, in some of our other studies that we've done, we've looked at homes with water and without water for a study that we did looking at Helicobacter pylori, which is a bacteria that infects the stomach and could cause gastric cancer and ulcers. And we were looking at people who'd been treated for infection and were cleared of the infection. And then we followed them along over time to see who got reinfected. And we found that actually people who got reinfected with the organism were more likely to live in homes without running water compared to homes with running water. We also, Jay Wenger, who used to be with our group, also did a study looking at colonization with a bacteria that can cause pretty severe illness and pneumonia, particularly in children. And he found that there was a higher colonization in the nasopharynx with the organism Strep pneumo in homes without running water compared to homes with running water. So we see a variety of different risks for infection, for many different infections, if you don't have running water in your home. So I was going to talk to you just very briefly on some recent work that we've done. This is a paper that came out, I think just, I don't know, it's amazing with the COVID time warp, that this came out in 2020. It feels like it came out years ago, but it actually did come out in January of 2020. And it was a study that was done, again, with a collaboration between the YKHC and Alaskan Native Tribal Health Consortium and ourselves at CDC. And we looked at the years 2013 to 2015 at 48 different communities in the Yukon-Kuskokwim Delta. So it was about 20,000 persons in those communities. It was a village level analysis that we did. And what we did was we looked at the incidence of 6 different types of categories of infectious diseases in those villages over that time period. And we looked at inpatient and outpatient visits. And this study was a study in which we kind of, once we had done the studies that showed us that piped water was definitely much better for lowering rates of infectious diseases than no piped water at all, people asked, well, what about small haul systems? Because a lot of villages, it's not just piped water or no piped water. There are a lot of villages that have small haul systems in which there's some water rationing going on. What happens with those villages? What's the effect of a small haul system compared, say, to full piped water? So that's one of the things we wanted to answer with this study. So we looked at not just piped, but hauled water systems. And what we found when we looked at homes with piped water, when we adjusted for a variety of different village level factors like income and age and crowding, et cetera, we found that with each 10% increase in piped water coverage in those villages, that there were distinct percentage decreases in pneumonia and influenza, respiratory infections, MRSA, which is a skin infection, and then other skin infections. So as the level of water service increased in a village for piped water, we saw these decreases in infections. When we looked at the small haul systems, we found that there was some improvement, that there was with each 10% increase in the haul service systems, that there was some improvement, but not as much. There was a 2% decrease in respiratory infections, 3% increase in skin infections. And when we looked at the hauled water service compared to the piped water service, we found that homes with the piped water service had a 37% decreased risk of pneumonia and influenza visits when compared to the small haul systems. So the small haul systems have an effect, and they are better than no water service at all, but they aren't as good as piped water. And again, I know that sounds very intuitive, but it was a question that came up, and we really didn't know the effect of small haul. So there is some effect of small haul beneficially on infectious diseases. However, it's not as powerful as the full piped water. And then we also did a study looking at piped water and consumption of sugar-sweetened beverages in rural Alaska. And this just came out in 2019, so fairly recently. And for this, we used the BRFIS data set, the Behavioral Risk Factor Surveillance System, and we looked at 2013 and 2015. We partnered up with the state of Alaska and ANTHC and us at CDC. And we really were looking at rural Alaska. So we excluded the urban areas, we excluded the hub towns, and we also excluded villages on the road system or the marine highway system. We considered a community to be unserved, that didn't have water service, if 55% or less of homes were served by pipe water, septic tank or well, or a covered haul system. So that was our break point for unserved versus served in this study. And so what are a few of the things that we learned from this study? Well, we learned that about, on average, people consumed about 8.5 sodas or sugar-sweetened beverages per week in rural villages, so a little over one a day. We found that men were more likely than women to consume the sugar-sweetened beverages, that about 28% more sugar-sweetened beverages were consumed by men than women. We also found a pretty big difference in age group, that there was more sugar-sweetened beverage consumption in the younger age groups, and that with each decade of life, there's a 20% less use of sodas. As you get older, people drink less soda and sugar-sweetened beverages. So when we looked at the unadjusted analysis for sugar-sweetened beverages, we found that 46% more sugar-sweetened beverage consumption per week in unserved communities compared to served communities. And then when we did the adjusted analysis, we found a 29% more sugar-sweetened beverage consumption per week in unserved communities compared to served communities. So it does look like there is more consumption of sugar-sweetened beverages in unserved communities where there is not as much water access. And that results in a whole variety of potential other issues and problems that we've done a number of studies to kind of document, with dental caries and a variety of other health effects that are not so great from consuming a lot of sugar-sweetened beverages. And then I'm just going to finish with, there's a list of the different publications that I was referencing, and trying not to go through each one of them because that would have taken too long. But these are the publications based upon which the slides were created. So if anyone wants to look up more information on them. And I think that's it for me. So that's it for me. Over, and I will stop sharing my screen here. Okay.
Thanks, Mike. So I think we're sort of coming up on the hour, but we have a few minutes for questions, and I don't see any questions in the chat. So I was just going to open it up to everybody on the webinar and see if anybody has any either questions or discussion points or. Okay, hearing none. Oksini, I just had one question. I saw some of your materials for COVID safe homes included some recommendations on humidity. And so I just sort of wondered the details of that, if you can recall.
Oh, I'd have to pull up the
Okay,
what we put on there, but some of the recommendations were very similar to what for humidity, what is recommended. So 30 to 50% humidity in a home is safe, safer than having less or more.
And then the only other question I had is there, this is all sort of focused on the home. Is there anywhere on the ANTHC where you're looking at sort of safety for COVID within other structures within rural communities? So I'm thinking about the schools and the stores and the village council buildings or.
So on the both on the ANTHC main website and then our ATCAM community resources page both touch on both. Our community resources page touches on the home, community, and clinical, and then business. I don't know if there's anything that we put on there that really touches on schools, but there is like stores, post office, and I even think some for small airlines on the business, under the business portion on the ATCAM website. And because we tried to touch every piece in a small community.
Great, thanks. So hearing no other questions, I think I'm going to sort of wrap it up. So this is one of what we hope to be a 3-part series on environmental health over the course of the winter, if COVID allows us to continue to get together and offer these. So the next one, we hope to focus more on the actual infrastructure of the house, innovations in running water, getting running water, or another system out to rural communities, innovations in the house infrastructure itself, and then another one more focused on outdoor air pollution and its links to human health. And then we do have our next meeting is hosted in conjunction with the One Health group at ANTHC. So I believe that meeting will be on December 8th, and that's where we get together and just look at One Health and the connections between human health, wildlife health, and the environment. So I want to thank everybody for joining us today, and I really want to thank our speakers, Dr. Bruce, Dr. Singleton, and Oksini for joining us from ANTHC. And I'll just turn it over to Hazel if there's anything that we need to discuss for wrap up.
I think that sums it up pretty well. As a reminder, the meeting was recorded and that recording will be posted probably before the end of the week. So if you want to check back to that event page, and I can drop the link in the chat, and the presenter slides are also available there. So if you wanted to follow up and you missed one point or something, those are available. But thank you all for joining and have a great rest of your day.
Thanks, everybody.
Thank you.
Thank you, Dana.
Thank you. Thank you.
Thanks, everybody.